Hello everyone, and welcome to the Problem Exploration webinar, Look Before You Leap, using data to avoid common missteps when asking why. I will now introduce our presenters for today. Joan Nelson Phillips is a CQI and practice improvement expert consultant with over 30 years of experience in working with state child welfare systems. Sherry Levesque is a program implementation and continuous quality improvement expert consultant with 27 years of experience in the state child welfare practice and leadership. Kate McElroy-Helm is a child welfare data systems and technology specialist with more than 12 years of experience providing training and technical assistance to states to improve data collection and analysis. I will now turn it over to Sherry to begin. Thank you.
Great, thank you. And I'm just going to go through our agenda and objectives for today. First today, we'll quickly go over our objectives and what was covered in the first event in this series. And then we'll dig into identifying contributing factors and root causes and strategies to identify those. We'll then move into breakout sessions, as Chris mentioned, where you'll have an opportunity to discuss with a smaller group how root cause analysis applies to a specific practice area. And then we'll finish up with questions and answers and sharing additional resources in those breakouts. So our objectives today are to identify the final 3 steps in the problem exploration process and strategies that can help analyze data and get to the root cause and contributing factors of a problem. We'll also identify common mistakes to avoid in this process and have an opportunity to connect with peers on this topic. So we're going to begin with a brief overview of our first event in this series, which was held last week and covered the first 3 steps of problem exploration. This event was recorded and will be available on our website in the coming weeks for participants who were unable to attend last week. In part 1, we presented the first 3 steps in the problem exploration process, which you see here highlighted.
Essential functions of problem exploration. The first 3 steps are: 1. Identify the problem. 2. Create a data plan to explore the problem. And 3. Collect and analyze data.
And this included why this process is so critical to change initiatives and the key components in these steps. We explored the elements of a data plan and how it can set the foundation for fully understanding problems, as well as strategies to collect and analyze data to explore those problems. And we also took some time to break out into smaller groups, as we will today, to discuss the kinds of data and questions that can help explore problems in permanency, safety and risk assessments, service array, and family engagement. With that event and with this event today, we really are striving to create foundational knowledge about problem exploration across a wide variety of levels of expertise in this area in our child welfare community. Just as a note, we plan to offer additional more targeted events in some of our existing and developing communities of practice. So if you are not a part of a constituency group or a community of practice related to your role and you're interested in being, please reach out to us through the contact info that we'll provide at the end of this event. So today we'll be exploring the last 3 steps in the problem exploration process, including methods to identify possible contributing factors and root causes, and data analysis strategies to support these steps. And we'll also discuss things to consider when deciding which root causes the agency or the team will address. Similar to the first event, we will then explore these steps through the lenses of permanency, safety and risk assessments, service array, and family engagement in our smaller breakout sessions during the second half of today's event. So let's get started with a quick poll. We'd like to take a few minutes to hear about your experiences with root cause analysis through a couple of questions. In the first question here, we're curious if your agencies have used a structured process like this before to explore a problem. And if so, if you have used this type of process before, were you successful in identifying a root cause? That's the short answer there. And so it looks like the vast majority of folks have had some experience using this kind of a process before. And lots of folks feel like they were successful in getting to a root cause. Some folks have sort of mixed answers. In some areas, yes. In other areas, no. A particular model for doing this kind of work, the APHSA model, somewhat successful. Too many causes, too complex. Yes, I think that is a very good descriptor of this process in child welfare, without a doubt.
Results for the polling question are as follows. Has your agency used a structured process like this before to explore a problem? 92.1% responded yes. 7.84% responded no.
That's great information, and I think that's good to know that a lot of folks on the call already have some foundational sort of information about this topic. And also, the mention of another framework is a good cue to mention that the framework that the center's presenting to do problem exploration is not a brand new framework by any stretch. It's really drawn from the research and literature that exists in many other areas and is very aligned with a number of other models that exist. Our effort was really to try to make it very concrete and to operationalize it so that people could apply it in their own jurisdictions. So another poll here to find out a little bit more. Since lots of you have had experience doing this kind of a process, we're curious what kinds of challenges you encountered in doing so. And then also, if you haven't used this process before, what kinds of barriers might you anticipate to doing it? Yeah, data quality is definitely one of the challenges for sure. The availability of data in general often, and data that's of sufficient quality to be able to rely upon it is definitely a common challenge. Yep, available data. The length of time it takes to truly get to the root cause, absolutely true. Oftentimes there are lots of pressure to find a solution quickly to a problem, and so it can be difficult to really allot the time needed to do this. Sometimes the root cause is something that costs money, absolutely. Absolutely, and so that can get you to a place where it's hard to see the solution out of. I think one thing I will just add to that is sometimes those are unsolvable problems. Sometimes the data that you've collected in order to get to the root cause can help you make that case more effectively. And anticipated barriers include, some of the exact things that folks have found to be barriers: inaccurate or poor quality data, missing data. Understanding what questions to ask of the data is a good example. That gets to the importance of framing the question in the right way and needing to have some good communication between often program and data staff in order to be able to do that. That's something we touched upon in the first event, for sure. Right, sometimes the solution has been dictated for you from external pressures. Very true. Very true. And funding, touching on funding again. Yeah, so you all have just done a great job kind of framing up the landscape that this root cause analysis or problem exploration work happens within. And so that's actually a great segue for us to dig a little bit further into the process of doing that. So I will turn it over to Kate now to talk about that a little bit further.
Great, thanks so much, Sherry. So let's spend a few minutes digging into exploring contributing factors and root cause analysis. In problem exploration, part 1 last week, we discussed a scenario where 3 different jurisdictions explored the problem of timely permanency, and ultimately they came to 3 very different underlying causes. So, so let's take the example of the underlying cause being underlying trauma, and think about this as a cause of a barrier to timely permanency. So in order to know the best way to intervene, the jurisdiction needs to know a little bit more about why the trauma is impacting permanency. A root cause analysis process and validation of the root cause with data is really critical to understanding the problem fully. So by engaging in this process, the jurisdiction, for example, might discover that the underlying trauma was a contributing factor because of the lack of appropriate trauma-informed services. It could be that foster and or adoptive parents are not adequately informed about the common behaviors in trauma-exposed children, or that foster and adoptive families are not receiving adequate support on an ongoing basis to manage those behaviors. So each of these root causes might need a different theory of change and a different intervention to fully address them. And without doing this work, the jurisdiction, the risk of they would risk not fully understanding what's really behind the problems that they're facing.
Problem exploration scenario. A box that reads, Timely Permanency contains 3 lines to the right, each pointing to 3 different boxes that read, from top to bottom, Underlying Trauma, Delays in Court Processes, and Cultural Biases. The box that reads Underlying Trauma contains 3 more lines to the right, each pointing to 3 more boxes that read, from top to bottom, Lack of Trauma-Informed Treatment. Foster or adoptive parents are not adequately informed of common trauma behaviors, and not enough support to manage trauma behaviors.
So root cause analysis is a data-driven approach to determine why a problem occurs and to identify opportunities to prevent or to reduce it. Data collection and analysis are really critical foundations for root cause analysis. While there are different techniques and methods for determining a root cause, the process typically begins by identifying possible contributing factors and then looking at the underlying root causes. The root cause or causes are the underlying source of the problem. And when teams are able to identify and address them, the problem can be addressed and alleviated.
An image of a tree is pictured, showing its roots extending below the ground. A box to the right reads, Presenting a problem, the visible outcomes of the problem. It is represented by the leaves and branches of the tree. The next point reads, Contributing factors, affects the outcome but is not the root cause. This is represented by a portion of the tree trunk above the ground and a portion of its roots below the ground. The last point reads, Root causes, a source below the surface that is the underlying cause of the issue. This is represented solely by the roots of the tree underground. Each of the last 2 points represented by the roots of the tree indicate the need to dig deeper into agency challenges to find contributing factors and root causes.
So here are some questions to consider when engaging in a root cause analysis process. What events or factors led to the problem? What conditions allow the problem to occur? What other problems occur at the same time as the central problem? And will the problem still exist if the agency corrects or eliminates the contributing factor? So answering these questions as a team with input from several different perspectives can help to identify the contributing factors and root causes of the problem. With that, I'm going to turn it over to Joan.
Thanks, Kate. So you're looking at this up on the screen. So one way to organize contributing factors can be by considering what exactly is impacting the problem across different areas of capacity. For example, resources, infrastructure, knowledge and skills, culture and climate, and then engagement and partnerships. And we can illustrate this by maybe walking through an example of these factors that are taken from the problem exploration brief that you'll all be able to access if you haven't already. And in this example, the problem has been identified as fathers not receiving needed services, and this is something I'm sure most of us are familiar with. The contributing factors
around this problem area might be organized around these different areas that you see up on the screen around organizational capacity. For instance, organizational resources might include that the agency doesn't have a sufficient number of staff, or that the staff that they do have don't have the time to effectively engage with fathers. Perhaps the agency has technology resources issues such as a lack of available quality data from their MIS systems that may impact their ability to effectively measure and monitor work that they're doing with engaging fathers. Infrastructure factors might include the lack of an available training curriculum that includes a focus on the engagement of fathers, or policies, or even a practice model that doesn't support the agency in meeting the needs of fathers. A contributing factor around knowledge and skills might include a lack of specific skills by caseworkers to effectively work with dads, or maybe even supervisors not having the skills to effectively coach or mentor their staff in this area of work. Culture and climate factors might include more adaptive agency challenges, such as the need to value equally the role of fathers in the lives of their children in the same way that mothers are. And finally, engagement and partnership factors might include a lack of engagement of fathers in terms of including their voice and their choice in assessing the needs of dads, or engaging them in a meaningful way in developing their case plans. So now we can turn our attention to the use of a fishbone diagram. And some of you may be familiar with this, but it's one method, not the only one, but one method to help a team think through the contributing factors to a problem. It kind of combines brainstorming with what we call kind of causal mapping. It's really just a way to visually display the ideas that you generate. Brainstorming not only about potential contributing factors or causes of a problem, but also those potential relationships between the different groupings when you kind of put it in a visual way. As a first step to creating a fishbone diagram, teams may try brainstorming and then listing out the possible factors and causes that come to mind. For example, what is the team learning through their data analysis? What is the data actually telling them? This helps the team consider the many possible causes and factors that are influencing the problem that they're facing. So using our previous example with fathers, the team might brainstorm some of the things that we've talked about a little bit earlier. The agency may have determined that they have no caseworker training, literally, related to the engagement and meeting the needs of fathers. It's just not there. Father engagement and case planning and assessment is not occurring. It's not visible in the data that they're looking at. The agency has an insufficient number of staff, perhaps working with dads, or the current staff that they have are indicating that they don't have the time to actively locate, engage, specifically maybe non-custodial fathers in order to assess their needs. And also the caseworkers may lack the skills in doing the actual assessment work with non-custodial fathers. And finally, the agency, through brainstorming, the team that's been pulled together may decide that the agency culture in general is mother-centric. It lacks any meaningful focus on the actual needs or engagement of fathers. After the initial brainstorming, the team then begins to build out the fishbone that you're looking at here. The problem itself is written into the circle or the head of the fish off to the right, and the team then writes the possible contributing factors or root causes along the bone. You don't have to use these groupings that you see here. This is really mainly for the purpose of walking through an example, so it may not be infrastructure or knowledge and skills. You may group them in a different way, depending on what the team brainstorms and how they seem to coalesce. The fishbone diagram can serve as a visual jumping off point for identifying possible root causes based on the factors that the group identifies. Some groups use the fishbone diagram together with the 5 whys technique that we're going to discuss in just a minute, where you're asking that why question on the selected bones to continue to get at those additional contributing factors. Other teams may facilitate activities to gain consensus around the root causes that are based on the initial ideas that are generated through the brainstorming session. But after the diagramming's been completed, teams should always return back to looking at the data that they have and that they've collected in order to verify the contributing factors they identified and then hone in on those root causes, always digging deeper. So now we're going to raise another polling question. And what we wanted to ask is whether or not what your experience has been. If we really focus in on the contributing factor in the previous example around non-custodial fathers not receiving the services that meet their needs, what has been your experience in this area? And what might be some of those potential contributing factors in working with non-custodial fathers? And if you could just go ahead and type in your responses, that would be great.
And Joan, while people are typing their thoughts in to the poll, some potential contributing factors that occur to me around this are potentially a lack of knowledge or skills about how to work with the custodial mothers regarding the need to engage particularly non-custodial fathers. Sometimes that's a difficult conversation that people might shy away from.
Absolutely. Okay, so we're starting to see some of the responses come in here. Court biases in working with fathers. I mean, that's something I think we've all encountered. When we talk about agency culture and climate, it's okay not to shy away from the fact that sometimes it's not so much organizations, but there might be pockets within your organization where staff are just literally more comfortable working with mothers than with fathers, or there are some of those biases.
Couple
Being able to
comments
locate
about
fathers. Go ahead, Sherry.
I was going to say there's a couple comments about conflicting values leading to conflicting instructions for staff. So either within the agency or potentially some values related to the court interactions.
Having some of the skill set to deal with that resistance. I think that's important too. So as an underlying issue, that might be a problem that an agency has. They know that the issue is that there may be a resistance to working with fathers, but not understanding what the skill level is going to be, what the lift is going to be in order to address it.
A lot of comments about the more technical challenges of actually being able to locate fathers and time constraints also in particular in regards to being able to do that.
Right. Okay. So obviously this is as familiar to all of us really in the work that we do in child welfare. Okay, well thanks so much for participating in this poll. I'm going to turn it over to Sherry, who's going to start to walk us through the 5 whys method.
Great, thanks Joan. And so, as you said, another popular and simple technique for identifying a root cause, and as I say simple, the technique is simple, sometimes the process isn't always, but is the 5 whys method. This method has teams repeatedly ask why, obviously, to drill down into a problem and its contributing factors. So with each response, the team, again, asks why regarding that response. So as you can see in this example, starting with the problem of why are fathers not receiving services, the team drills down through 4 contributing factors to a root cause of an agency culture that does not value the engagement of fathers equally to mothers.
A staircase of 5 boxes that read, why, each with an arrow underneath, pointing to the next box on the staircase and a contributing factor. From top to bottom, the contributing factors are not enough services, not enough partnerships, not looking for ways to secure services, not enough fathers in program and policy development, lack of voice, and lastly, mother-focused culture not equally valuing fathers.
So as you mentioned, the fishbone exercise can be used in conjunction with this method. If the fishbone has occurred first, the brainstorming in that exercise can ensure a broad range of potential factors are considered by the team in answering each level of the whys, or you can use the 5 whys method for each of the bones on the fish. Typically, teams will repeat the why question 5 times, but that number is only a guideline. It may take more or less than 5 whys to get at root causes. And at some point, particularly for complex problems, there may be more than one why reason. So you may go off in 2 branches. Teams should keep asking why until there seems to be no new information or no new potential areas that the agency can address. And after completing the 5 whys, a Wye tree can help teams illustrate the logical connections between multiple factors and root causes, or even identify other ones that could impact the problem. So this is an example of a Wye tree here on the screen. You can see the teams put the problem at the top of the tree and enter each of the first level of contributing factors from the 5 whys in the first level of the tree. And then at each level of the Wye tree, the team should try to confirm that response with data or evidence rather than making assumptions. So as they get to the bottom of the tree, the root causes should emerge. So for example, in our scenario about the problem of fathers not receiving needed services, one of the first whys was a lack of service availability, which was confirmed by a state survey of service providers. When the team asked why that was the case, they learned that fathers are not engaged in program planning efforts that could lead to development of services to meet their needs, and so on, proceeding down the Wye tree.
The Wise tree. A generic Wise tree contains a box at the top of the tree that reads, Problem. 2 boxes branch out below and read, from left to right, Reason Why, 1A, and Reason Why, 1B. Below Reason Why, 1A, 2 boxes branch out. To the left, the box reads, Reason Why, 2A1, and, to the right, Reason Why, 2A2. Below Reason Why, 1B box, the box reads, Reason Why, 2B1, and Reason Why, 2B.
It's important to assess whether evidence supports the possible root causes, as I mentioned. If the team relies purely on speculation or opinions, it runs the risk of selecting and attempting to fix the wrong thing. So while teams might not have data for every link in the chain, we saw a lot of responses to the poll earlier about data quality or availability of data challenges. While a team might not have data for each of the links leading to a root cause, ideally they should strive to provide evidence for as many links as possible. This data can then serve to support and validate potential root causes or to rule them out in some cases. Additional sources of data that can be used to validate the root cause can include, and you see here on the screen, data from partner organizations or stakeholders such as courts, tribes, private providers, health and education providers, or other community partners. Can also include data from surveys or focus groups that are conducted particularly among a sample of the audience affected by the problem or key stakeholders to help confirm or refute theories about possible causes. Or from opportunities to partner with agency data specialists or a local university on more rigorous research analysis in selected areas. And these types of sources can help ensure that the root cause or causes are validated before moving forward.
The slide is entitled, Analyzing Data for Root Cause Validation. 3 circles read, from left to right, looking deeper at the affected population, visualizing data in charts or graphs, and disaggregating data, breaking it down. A box below the circles reads, Assessing Feasibility, Seeking Expert Support.
So you might recognize these strategies from the Collect and Analyze data step from part 1 of this event series, but these same strategies can also be used for data analysis to validate the root causes. We're going to dig a little bit deeper into these today, but note that these methods are important to both steps in the problem exploration process. Let's take a few minutes to look at how each of these strategies can help to validate root causes. Examining the characteristics of the groups most impacted by a problem will help a team see areas where they want to dig more deeply, either perform more analysis or add different data sources to fully understand the problem. The goal is to get as specific as possible about the population that's being affected by the problem. So in our example, we've identified that non-custodial fathers are the most likely not to receive needed services, and this seems correlated with a lack of visits with these fathers. We're able to further drill down and determine that this impact is most pronounced in certain circumstances, specifically with non-custodial fathers of children under the age of 3, in urban areas, or with substance abuse issues. And we then need to go on to ask why these things are the case. Why is this particular population not being, or populations not being visited and receiving needed services? Asking why here could lead to questions about agency processes or agency culture or both. Oftentimes, improvement plans only focus on one of these aspects or the other, a process or a culture issue, which can result in changes being implemented that don't really impact the problem that they're trying to solve. One note about analyzing this data, it's particularly important to consider comparison groups during this process. So for example, if a team is trying to understand which non-custodial fathers are not visited, the team might be tempted to pull only cases with non-custodial fathers without visits and look at that data to see what's going on in those cases. It would be more informative, however, to look at all cases of non-custodial fathers, those with visits and those without visits, in order to be able to compare them and identify potential differences between them. Some problems might be simple to analyze quantitatively. However, for many areas of child welfare practice, the available quantitative data can only tell part of the story, and teams may need additional data collection, such as case reviews or surveys, particularly to understand the why part of the problem exploration. And so it's worth restating here that the importance of stakeholder engagement in this part of data exploration. Stakeholders, especially families who have received services, frontline staff, and service providers, have different perspectives from program leaders quite often and may be able to identify different possible explanations to answer the why question. So I'm going to turn it over to Kate here to look at some data examples.
Great, thanks, Sherry. So visual displays like bar graphs, pie charts, and maps, and lots of other examples can really help a team bring data to life by illustrating what is discovered during that analysis. Using data visuals can help a team understand the characteristics and see variations in the data more easily than if you were just looking at numbers, for example. This can be especially effective for looking at demographic and service characteristics and also looking at trends over time. So let's take a look at the data in this chart on this slide that shows, this is just an example of some data around how this fictional agency is doing with monthly visits with custodial and non-custodial fathers during a 6-month period. So you can see from the bar graph that on the left we have the non-custodial fathers, which were successful about 30% of the time over the past 6 months, and then with custodial fathers at about 70%. So very straightforward information, but you can really easily see here the fundamental differences between these two groups. So then here we have some similar data on visits with custodial versus non-custodial fathers, but we've broken it down further, or disaggregated it further so that we can get some more detailed information. So what might this data tell us about the contributing factors that the aggregate data in the last slide did not show us? So as you'll see on this bar graph, we have in-home services, foster care for both non-custodial and custodial fathers. What are some of the questions or some of the things that jump out that you wouldn't have known from the previous slide that might help us get it one step closer to root causes around this area? We also have it disaggregated by what we're calling areas 1 through 4, which would be geographic regions in this fictional agency.
So while folks are typing their thoughts about your question into the chat about what this is telling us, Kate, one thing that jumps out first probably to most people is that non-custodial fathers in-home cases are the least likely to be visited of all the groups.
Right, yeah, by quite a bit compared to some of the other groups.
Mm-hmm. Right, and non-custodial fathers in general are least likely. After that, in general, whether it's foster care or in-home.
Right, you can see really quickly that the left side, those two groups of bars are lower than the others. And so these kinds of things often can, while we're identifying things, can lead us to more questions or kind of the next level of exploration around this. So what other questions might you have? You can type those into the chat as well. Any questions that you'd want to look at as kind of taking the next step, further breakdowns or other kinds of analysis. We have a question in the chat around whether there are policies that relate to non-custodial versus custodial fathers, if there's more of an emphasis on custodial fathers or those that are more actively perhaps involved in the case planning process, if there's a distinction there.
Yeah, I think that's a great question. It makes me also think about how the workforce is actually structured, whether you've got workers that are tailored more to work within home families versus foster care cases. States all do that work differently.
Right. Service array differences in each region. So what are some of the other differences across regions that might be contributing to this difference in kind of performance in these areas? It's a great question. And staffing differences.
And I noticed, Kate, that area 2 in the green, if you look across all 4 categories, you know, it's not the highest performance in the custodial fathers, but it's relatively high performance kind of across the board of all 4 groups. So it makes me wonder, you know, what are the policies or culture or, you know, direction in that particular area around fathers' engagement compared to the other areas.
Right, that's a great point. And you know, depending on how you're looking at the data, you can there might be other ways to look at this very same level of analysis. Like if we wanted to put all the data for each area in one kind of grouping, that might help us. You know, or if we're sharing that with a group and we want to kind of start looking at that, or whatever the factor is, we could display the data just a little bit differently. It's the same information, but could be just shown a little bit differently. We've got a lot of stuff in the chat.
Someone just had a question about, you know, how we were defining foster care versus in-home, which is a really great sort of call out of the importance of the research question and kind of narrowing that down before you're pulling the data.
Right, and then being clear with that as you're sharing it, which cases are being included in each one. Some curiosity around additional time points, looking at trends over time is always an important thing to look at to see if there have been fluctuations, which direction performance is going in, that sort of thing. Some kind of the next level information around why the visits aren't happening based on the father's willingness to participate, or there might be some other things that are affecting that. That's a great next question.
Yeah, and a couple of questions that kind of get at the capacity or the resources and supports being used to engage custodial fathers, and you know, the why around why those are not applied similarly to non-custodial fathers.
Great. And then, of course, data quality is always a great question. Sometimes we hear that there are visits happening that just, for whatever reason, aren't documented in the system. Or there could be other factors where by the time it gets to this type of analysis, there might have been some issues leading up to it that might affect the data quality. What's the relative volume of cases represented in these percentages? That's a really great question, too. What are we talking about just a few cases or hundreds and thousands that can make a big difference in what the numbers look like and provide some really important context, especially as we're thinking about approaches. Okay, great. You can keep typing those in, and we'll share those with each other as we continue on here. Okay, so let's take a look at this visual display, data display on permanency. So this is a little bit more complex, and it has a lot of information. What can you read from this type of display that could help to inform or validate a root cause and permanency? So just to give an overview, we have at the top there's some information on what's included in this, children and youth, their ages, and the fact that they were in out-of-home care on a particular date. in this case 9/30/2016. This is just an example, but we can assume that this is an example state and the data source. So on the left top, we have how old were those children in care. So we have it broken down by age groupings. Where were they living on this particular date? And you'll see that the bar charts are stacked based on the age of the child, so those colors correspond across. And then what are the children's documented primary case plan goals? Again, broken down by ages. And at the bottom we have how long the children and youth have been in care during this removal episode. And the size of the circle is aligned with the number for each length of time. So again, it's a lot of information. You can take a moment to think about what this is telling us, and you can again feel free to type into the chat anything that really stands out to you as far as the data, things that you'd want to think about more, and maybe some next questions that you'd have based on what's displayed here.
Yeah, I think while people are chiming in, what strikes me is that first of all, we're talking about a completely different problem area, and we're really looking at a different level of complexity of kind of reporting the data out. That's one thing, but it's also designed in a way to be simple. At first glance, it's complex, but there's a simplicity to it in terms of the color coding, the size of the circles, and things like that. So that's kind of what strikes me.
Definitely. We're as you mentioned, we started again at a pretty high level. We're talking about permanency, which is a very complex topic and lots of avenues we'd want to go down to explore. Somebody called out that there are children 0 through 5 with an emancipation goal listed here. And so, right, our first question would probably be data quality. We'd want to definitely validate those and make sure that that's to see what's going on there, and then go on to the next steps if that's being documented that way. Try to figure out why that might be.
Okay, one of the first things, again, that jumps out at me is you would, along the bottom row there of the circles, you would expect to see pretty much a decreasing size of the circle as you go along through the longer time periods that kids have been in care. You know, sometimes jurisdictions do have a kind of a group of long stayers in the 36 months or longer that, you know, might be a little bit larger than those before, but this particular example has a surprisingly large group of children in that 36 months or longer bubble. So that's the first, you know, in thinking about permanency or timely permanency overall, that's the first thing that definitely pops out at me.
Yes, that is it's the largest number, and it's a lot larger than any other groupings that you'd expect to see. So yeah, I would definitely want to see some further disaggregation of that and find out who those kids are. There's a question in the chat too around looking specifically at the older youth in care. What's the percentage of youth that make up the just over 4,000 for 36 months or longer? Right, and some of those next questions, what's the permanency plan goal? What are some of the other movements you've made through the system, that sort of thing. We want to look at age breakdown for 36 months or longer and where they're living. That's a great question too. Okay, great. Thanks so much for these great comments and questions. I'm going to move us on to the next. We have one more example. So this display shows time and care across different age groups and placement types. So again, we're talking about children and youth in out-of-home care on a particular day. So across the top row, you'll see the age groupings. So it's divided into 3 different columns. And then within that, we have the placement types. And then along the column on the left, we have the lengths of time that the child has been in care as of that particular date. And so for this particular display, it also uses colors to, as the length of time in care becomes longer, it changes from green to yellow to red. And again, the boxes correspond with they're larger for larger numbers of children. So what are some things from this that jump out at you that can help get to those next questions and identify root causes in issues related to timely permanency?
So Kate,
for me, I look. Go ahead.
You're probably going to say the same thing as me. A lot of the kids that are in that 36 months or longer group that we were just looking at that large circle for on the previous page, a lot of them are in non-relative foster homes is one of the first things that I see when I just quickly look at the size of the boxes.
Right. And also, I was going to say, too, that there's a large group in that 6 to 12 age range. It looks like more than in the teenagers, which you'd kind of expect. All right, question around mental health, and there could be other factors related to institutional policy and permanency for those older youth. Great. All right. Well, you can continue to type those in the chat. I'm sure other folks will continue to follow along with those. And I will move us on.
Okay, thanks, Kate. This is Joan again. So moving forward, after the team has identified the possible root causes by looking at all this fabulous data that hopefully they had access to, the team's going to want to think about the feasibility, the reality of actually addressing each of them, and then taking into consideration such things as what you see on the screen here. So the stakeholders' perspectives on the root cause and their ability, the agency's ability to actually address it. Factors that may serve either as barriers or facilitators for addressing the root cause. External factors, this could include organizational culture, infrastructure issues, the agency's available resources. Internal factors, things like that. What are the available timeframes or constraints to addressing root causes? For example, is the agency under a court or consent decree? Or what are the federal or state process requirements? Organizational support that's in place to address the root cause. This includes leadership support and buy-in. Specifically, is that support that's going to be needed going to be there at the time that it's needed? And any risks to addressing a particular root cause. For example, is it going to require a diversion of existing resources and attention pulled away from other priorities? Is it going to potentially cause a cascading effect on other practices or create workforce strain, things of that nature? So the team that's been pulled together is going to need to come back around and consider these factors again and more in depth a little bit later in the process when they move into creating a theory of change and actually planning for their intervention that's going to address the root causes. Once the team has identified and validated possible root causes and explored feasibility, it's going to be time for the team to select one or possibly more than one, a few of the root causes to address as part of the agency's change initiative. So the final selection should reflect and actually be documented along the following lines, to at least include the following. First of all, the data and research that has been organized and analyzed that points to the root cause as being the source of the problem, always being evidence-driven. Secondly, the likelihood of being able to address the root cause based on the feasibility considerations that we just kind of laid out there. And finally, that there's consensus among the team members, that everybody's in agreement in terms of the feasibility of the agency being able to successfully address the root cause that's been selected. Again, keeping in mind there might be more than one, and there's going to have to be decisions that need to be made. So now we're going to lead into some common missteps in root cause analysis or deeper problem exploration, and I'm going to ask Sherry to join in on this as well. But we just want to make sure that we put a few of these up here. I'm sure you guys have experiences with this as well. So let's just consider some of the more common mistakes or pitfalls that can occur when conducting this level of analysis. So one of the things that comes up is just not, taking the initial results as evidence of the root cause and then limiting the analysis to a single pathway and not digging deeper. And what we mean by this is sometimes you have members on a team where they already feel like they know from previous experience or analysis of looking at a problem, because some of the problems agencies deal with are intractable. They've been ongoing for a long period of time, and they already feel like they know what the root cause is. They've already looked at it, and they want to move on quickly to developing a theory of change or selecting an intervention. So sometimes the due diligence around the data exploration hasn't been done, so that's a common misstep. Another one is not ensuring that all stakeholders on the team have a common understanding of the problem and its contributing factors and root cause. And this can come from not taking the time early on in the problem exploration process, really along the lines of what we talked on last week's call, the first 3 steps, where you really, really dig into the data. And so not taking the time to really make sure that everybody on the team has an equal understanding of the data that's being used to examine the problem, that everybody's up to speed. Also using a limited population of stakeholders, again, on the team. An example would be if it's management heavy and offering answers to why the problem is occurring. And this is a really common misstep. It tends to give agencies a biased or maybe a monocular view of the problem, and that's why selecting the right team is so important, not only at the beginning of the process, but re-examining the team's setup from along the way. Identifying or selecting interventions that address a contributing factor or a singular behavior and not looking at the entire set of contributing factors and root causes. And finally, focusing on solutions only around kind of the policies and processes, which would be more of a technical approach, when it might be really more of the agency's culture, climate, beliefs, and values, the trickier adaptive challenges that are the bigger part of the problem. So what are some of the other kind of common mistakes or missteps that you've experienced around root cause analysis in your own agencies? And if you could just type in some of your responses so we could share with the group before moving on, that'd be great.
Joan, one example of that, that last one I see on the slide there could be in trying to address challenges with concurrent planning for permanency. So it makes me think that an agency might find that they have a challenge through the CFSR or some other data and determine that, the issue is that staff are unclear about the expectations for concurrent planning activities, or maybe that staff don't feel they know how to talk to parents about 2 plans at once while still engaging them. And based on that, they might plan to revisit their policy around concurrent planning or provide specific training. And although those might be important steps to improving it, they might only be one contributing factor or root cause of the issue, and some additional data collection or some additional asking whys might lead to the need to involve the courts as stakeholders because there might be that one of the challenges is really related to a shared vision with the courts around concurrent planning.
Right. Those are great examples. And I see some postings from Julie, Kim, and Kelly, and I appreciate that. Just, again, some of the things we had up there, just jumping ahead and assuming things don't exist, solutions aren't already there, and not having done the due diligence, which is what we kind of talked about. So the last thing we want to talk about, because we're going to be setting up for our small group, breakout groups in a little bit, is just spending a minute on strategies then. So around these common missteps, how you can kind of avoid them or kind of walk around them or address them. So one of the things would be to maybe just really make a diligent effort to include stakeholders from different groups throughout the process rather than at singular points. So the teaming process is so important. I think we all know this. It has to be reevaluated. A change initiative can take a long period of time to get through. So it's important to constantly be re-examining it and be inclusive throughout. Also thinking critically about how data is presented to your stakeholders in a way that's meaningful and understandable. And what we mean by this is that it's certainly management may be used to looking at certain types of reports, or if you're a CQI director or your staff are used to looking at reports and you have a certain amount of comfortability with it. The people you bring to a change initiative, your stakeholders may not have, likely don't have that level of familiarity. So taking the time to educate and support them throughout the entire change process is critical. Also engaging your stakeholders and validating that root cause or causes. It's important at this step that we're talking about now because it also helps kind of lay the groundwork down the road. It creates buy-in towards your broader change effort. So bringing people to the table in a meaningful way helps lay the groundwork down the road that they're going to be part of your change effort. And then similarly ensuring that you've just got a variety of voices at the table. Parents, youth, courts, frontline workers, different levels, different program areas that have really contributed to the root cause analysis. There's not a lot of questions about whether the why has actually been fully examined. Those are some of the strategies that you can use. So with that, I'm going to, we're running close on time here, so I'm going to wrap it up.